Hello, ma'am. My name is Bishra Awad, and I will be the nurse assisting you to prepare for Mohs surgery today. My job is to make sure that you have the smoothest transition into the surgery and that you're set up in the best way for success. How are you feeling today, ma'am? Nervous, I'm sure. Yeah, well, a lot of patients are, but I can assure you, you will be in the best hands. Our surgeons are fully qualified and they have done this so many times. They have such a high success rate. There is nothing for you to be worried about right here. Okay, so let's get started with the prep. As you may know, you'll be going through Mohs surgery today. And now, Mohs surgery is a precise surgical technique. It's used to treat skin cancer. During Mohs surgery, thin layers of skin containing cancer will be removed and examined until you're cancer free. So in Mohs surgery is also known as micrographic surgery. Now, you may be wondering what we will be removing today. Well, today we'll be surgically removing something called basal cell carcinoma. Basal cell carcinoma is cancer that begins in the lower part of the epidermis, which is the outer layer of skin that's covering basically any part of your body. It may appear as a small white flesh-colored bump that grows slowly and may bleed. Basal cell carcinomas are usually found in areas of the body exposed to the sun a lot. So, which makes sense because, as you have said before, you've experienced a lot of sunburns as a child because you live near the beach area, that's fine. This is usually something that we deal with a lot of people who have been burned quite often. Basal cell carcinomas rarely metastasize. So metastasizing means like they spread from like being contagious basically. So they don't usually do that. They're most common form of skin cancer, by the way. So it's not something like super like rare or something. It's very common. Now their surgery might need to be repeated to help make sure that all cancer has been removed by excision. Excision is basically removing it out surgically, which is often used as a way of treatment. That basically is like right then and there, we take care of the surgery, you're good to go. Along with a margin of normal, skin is usually removed. So whenever we remove the cancer cells, we usually remove a little bit of the normal skin. So we make sure that it's all out, that there's no like carriers or like infected areas that might like develop later. So Mohs surgery has the best cure rate for basal cell carcinoma. Our dermatologist will be performing the surgery today. Dermatologist is basically a medical practitioner qualified to diagnose and treat skin disorders, including skin cancer. Now, I will start explaining what happens during the surgery and break it down for you step by step. So you will have no worries at all. You'll know what's going on all the time. You'll stay informed. That's the best way to avoid any complications. So the first step, depending on the location of your basal cell carcinoma, which for you happens to be on your face, you will be allowed to wear your street clothes in this one because you don't need, it's not in anywhere in your body or torso. So therefore you will keep your clothes on. In this case, the dermatologist examines the spot where you had your biopsy, which is a biopsy is an examination of tissue removed, and may mark it with a pen for reference. It's just simple and straightforward. The doctor positions you for the best access, so which may mean you're sitting up or lying down, depending on the doctor's decision. And a surgical drape will be placed over the face because that's where it's positioned, right here. Which means that you can't see much throughout the surgery, but I can assure you, you will stay informed because we will tell you every step of the way. We'll make sure you're awake and you're good to go. And the doctor will talk you through it. Now, the surgeon injects local anesthesia into the infected area, which numbs it up so you will not feel any pain, don't worry. And you can stay awake throughout the whole procedure, which might be shocking, but I assure you, there is nothing to be worried about. The second step is the doctor using a scalpel, which is a small knife with a thin blade that is used for very precise procedures. The surgeon will remove a thin layer of the visible cancerous tissue. And then during that time, we'll wait for the lab analysis, which comes next to your wound, which comes next, your wound is bandaged temporarily. And you can relax throughout that time, you can talk, everything will be normal, you'll be fully conscious, and you'll just be basically relaxed throughout that time. Now the third step is the surgeon cuts the tissue into sections, and he color codes them with dyes to draw a map of the surgical site. In the lab, a technician freezes the divided tissue, then cuts a very thin horizontal slice, like a layer cake, basically. The slices are placed into a microscope, slides, stained, and covered. This meticulous process takes time, so please, we will need your patience in this part. Especially with the lab procedures and stuff, they have to be very, very careful, so there's no like misunderstandings or anything, and there's no miscalculations. So also the fourth step is using a microscope. The surgeon examines all edges and underside of the tissue on the sides and on the slides, and if any cancer cells remain, marks their location on the map, and then the physician lets you know whether you need another layer of tissue removed or not. So back in the operating room, the surgeon injects more anesthesia if needed, and removes another layer of skin. Now, the reason why he may put more anesthesia is because like a lot of time would have passed by, so the anesthesia is going to start wearing off because there is circulation in the area still. So so after removing another layer of skin, precisely where the cancer cells remain based on the map. Then while you wait, the lab work begins again. This entire process is repeated as many times as needed until there is no more cancer cells. Now, the sixth step, once this site is clear of all cancer cells, the wound may be left open to heal, or the surgeon may close it with stitches. Well, in this case, we might need to use stitches since it's the face. Excuse me. This depends on its size and its location, and usually with the face, we like to be careful to not leave any scar tissue, so we will need to stitch it up. In some cases, the wound may need reconstruction with a skin flap where the neighboring tissue is moved into the wound. So since it won't be able to heal as well on its own, it's going to need some assistance from other parts of your body. So in some cases, your surgeon may coordinate to repair your wound with another specialist, such as a plastic surgeon, who is a person who performs operations that change the shape or appearance of the part that's affected, or an oculoplastic surgeon, which is an expert that knows the intimate details of the eye, the eyelids, and facial region if needed, which I'm pretty sure we will not need it, but we have to cover all bases, right? If needed. So in most cases, however, most surgeon will repair the wound immediately after obtaining the clear margins. Now, the seventh step, if more than 1 or 2 rounds are needed, they will be taken, and so be prepared for that, and it's worth it. Trust me, we have to make sure that all the cancer cells are taken out, so there's no more infection, and you won't have to do this again, which is what we need, right? Yeah. Because this precise technique has the highest cure rate of any treatment method and can save the greatest amount of healthy tissue, leaving the smallest scar possible. So it's very accurate, and this is why surgeons like to use it. So carefully follow the doctor's instructions for wound care after the surgery, of course, and the scar care will follow up to achieve the best outcome and to leave the least amount of scarring on your face. Now, there is the small possibility of there being a little bit of scarring, but that is fine. We will take care of it, and we will find the best way to get rid of it. Now, since the surgery is very time consuming, it should take up to 1 to 3 hours if needed. After your surgery removes the first layer of tissue, which takes about 10 minutes, the waiting room you would be waiting in the waiting room about half an hour for the lab reports. After the surgeon examines the tumor. Now, we've covered everything about the surgery, so we have to schedule you coming in to remove the stitches. So, when would the best time for you be to come in next week for stitch removal, considering that today is the 8th of October? Let me see here. We have the 16th, Tuesday the 16th at 12 p.m. Would that work for you, ma'am? Oh, awesome. Thank you. I'll go ahead and schedule for that one. Please feel free to call at any time to reschedule if something comes up. I know life happens. But please be sure to make it like 24 hours in advance so we have time to work around your schedule, and I would be more than happy to work with you to reschedule. So, how are you feeling after all this? I know it's a lot, but hopefully you feel much better and more informed now of what's going on. I know that there is no reason for you to be worried at all, and I want to assure you that you're in the best hands, ma'am. Okay, are you ready? Time to go meet the surgeon. All right, good luck on your surgery, ma'am. Have a good day.